I think if you have a new diagnosis of a long-term condition, just be aware that you don't need to let this condition define you. You're still the person you were before this condition.
The very, very hardest thing that I feel with getting any health label is to accept it. It takes a lot of effort and a lot of guts to accept it. The next thing is to know that you're in control of your future.
It can feel very overwhelming, especially if you obviously have been doing your research and health practitioners are talking to you about things like your health outcomes, risk, probability, etc. What I would say is live in the moment, plan for the best and take each day as it comes. Because with chronic conditions and, with life in general these days, you just don't know what's around the corner. So it's better to live in the moment, do the best you can, and arm yourself with information either way.
The best thing is to accept what's happened and to get as active as possible, as quickly as possible, by seeking advice, looking at alternatives, and really thinking about where you want to be in the next 5 years, 10 years, whatever. So long-term planning, because once you have a chronic condition, that's what chronic means, you've got it until the end.
Just reflecting on when I learnt that I had, a vision impairment that was going to really affect my life, I think taking the time to research it and find out as much as you can about it, and perhaps seek out other people who have gone through or are going through a similar thing, to see about how they manage it. But just research, find as many tools and as many things that can make having that condition as easy as it possibly can.
When a person has a long-term health condition, it is very helpful if you really understand what the condition is all about and what sorts of things you can do in your normal daily life to not let it get worse and to be as well as you possibly can be. And that probably involves asking lots of questions of your treating health professionals. The health professionals can help a patient manage their condition by developing a good relationship with them, a rapport, so that any questions that you might have, you feel comfortable talking to the doctor about. A long-term health condition can possibly change over time or change the way you feel about various things over time. It's worth keeping those conversations open with your doctors.
They need to prompt people to ask questions, not just assume that people will ask if they don't understand. A lot of people will not ask. So if they prompt them and say, do you understand what's happening? Are you comfortable? An attitude like that, I think, will go a long way.
Just listen. I think it would be really great to have health professionals who actually actively listen to your concerns and try and understand your need for holistic healthcare as opposed to just a prescriptive approach of, you're in here today, I'm going to give you X medication and send you off.
Really listen to what you want to get out of your life and how you want to manage your health condition. Respect the way that you're doing it and acknowledge and praise what you are trying to do to help do the very best you can.
It's important for friends and family to understand what condition a person might have, how it can affect you, how they can help you, or things that will be problematic for you. But just to be open to having conversations about it so that you're able to talk about your condition if and when you need to.
Overall, support the decisions that you're making. Empower you to support those decisions and not place their value systems on the way you're managing your conditions.
I know it can feel really hard to talk to someone about something as personal as their healthcare, but it really helps and it opens up that dialogue. And then, even the person living with that condition is more comfortable because you're now more aware. So, what I'd say is if you have someone in your family or friend circle who's been newly diagnosed with a chronic condition, take some time out, take them out for a coffee and just have a chat about how they're going, how they're managing, and just ask how you can help. Because, sometimes that's all a person needs.
I write everything down if I'm going to attend a doctor, especially a new specialist, maybe that I haven't met before. And I write down everything else as well, so they're aware of I do have other conditions. I'm not just here for heart or lungs or the relevant diabetes or whatever.
In particular, if you're being given bad news, you may not take in everything the doctor says. You may not ask the right questions, and we all walk out of doctors' surgeries with, I wish I'd asked that. It's also important to take someone with you that you trust. And if you trust them enough, allow them to ask questions on your behalf.
If you're going to be told some information by the doctor, you can actually say, can I record this? And I use my phone when I do that. So I just push the voice memo on there and put it down on the table and say, I just need to think through what you're going to tell me. And so if you're okay, can we just record that? And I find most doctors are happy with you doing that. And if the doctor's not, it's not because it's a wrong question to ask. You should actually say, well, how are you going to provide the information to me? I want it written down then.
Having a list before I go in, because it's usually takes a while to get in to my GP, and so I want to make the most of it. So I have a bit of a list before I go in of the things that I need to address.
Don't be afraid to ask questions. Often the doctors don't have time to go in detail with you, or they may use medical language that you don't understand. It's okay to say, please explain. It's okay to ask dumb questions. And it's important to know your rights and to speak up.